Hello friends, welcome to PharmaGrid. In this video, we are going to discuss 5 more KAPS recalls questions. So begin with question number 26. Choose the correct mechanism of pralidoxim in organophosphate poisoning. The options are inhibit acetylcholinesterase, treat CNS effects of organophosphates, regeneration of inhibited acetylcholinesterase enzyme, both A and B. So here the correct answer is option C, that is regeneration of inhibited acetylcholinesterase enzyme. Organophosphates are irreversible acetylcholinesterase enzyme inhibitors commonly used as agricultural insecticides. In addition, they are frequently used for suicidal and homicidal purposes. Toxicity with these agents is manifested as nicotinic and muscarinic signs and symptoms. So this pralidoxim is a cholinesterase reactivator used to treat organophosphate poisoning. It is unable to penetrate into the CNS and therefore it is not useful in reversing the CNS effects of organophosphates. The presence of a charged group allows this pralidoxim to approach an anionic site on the acetylcholinesterase enzyme, where it essentially displaces the phosphate group of the organophosphate and thereby regenerates the enzyme. So this pralidoxim acts as an antidote for organophosphorus insecticide and nerve gas poisoning, but it should be administered intravenously within minutes of exposure to an acetylcholinesterase inhibitor because it is effective only prior to aging. Aging means loss of an alkyl group. So if given before aging of the alkylated enzyme occurs, it can reverse both muscarinic and nicotinic peripheral effects of organophosphates, but it cannot reverse the CNS effects caused by organophosphates. Next question. Which of the following drugs can be used as first line for the management of cystitis? The options are nitrofurantoin, doxycycline, amoxicillin and moxifloxacin. So here the correct answer is option A, that is nitrofurantoin. Nitrofurantoin is generally considered as the first choice antibiotic for simple cystitis. So this cystitis means infection of the urinary tract, that is a lower urinary tract or more specifically the urinary bladder. So this cystitis means it is the inflammation or infection of the urinary bladder. It can be categorized as either complicated or uncomplicated. Uncomplicated cystitis refers to lower urinary tract infection in either men or non-pregnant women who are otherwise healthy. That is, uncomplicated means simple, not that much complicated. On the other hand, complicated cystitis means that are associated with some kind of risk factors that increase the likelihood and danger of the infection or the chances of failing antibiotic therapy. This acute cystitis is mainly caused by bacterial infection of the urinary bladder, and women are particularly susceptible to this kind of infection because due to the close proximity of the rectum to the urethral meatus as well as the relatively short urethral length in females. Okay, this is the reason why women are particularly susceptible to acute cystitis. Okay, now let's see the causative organisms for cystitis. Escherichia coli is the most common etiologic agent in uncomplicated UTIs in women, followed by Klebsiella, and other etiologic pathogens include species of Enterobacteriaceae family such as Proteus mirabilis and other bacteria such as Staphylococcus saprophyticus and Enterococcus. And this Escherichia coli is also the most common cause of complicated cystitis, and other organisms includes Enterobacter, Citrobacter, Serratia, Pseudomonas, Enterococci, Staphylococci and even fungi. So this E. coli is the most common etiologic agent in case of uncomplicated as well as complicated UTI. Okay, so now let's see the treatment options. Acute cystitis is mainly treated with an antibiotic therapy. The selection of the antimicrobial agents should depend upon the patient's risk factors for the infection with multiple drug-resistant organisms. And here you can see the antibiotic drugs which are mainly used for the treatment. The first one is, or the first line option is nitrofurantoin, 100 mg twice a day for 5 to 7 days. Then sulfamethoxazole trimethoprim, double strength, twice a day for 3 days. Then fosfomycin 3 gram as a single oral dose. Next question. Folic acid is essential for the synthesis of. Options are DTMP, that is deoxythymidine monophosphate, uridine monophosphate, deoxyuridine monophosphate, and ribose monophosphate. So here the correct answer is option A, that is DTMP, deoxythymidine monophosphate. Folic acid, also known as vitamin B9, is a water-soluble essential vitamin that is converted to tetrahydrofolic acid in the body. This tetrahydrofolate is the biologically active form of folic acid. The main role of folic acid in biochemistry is the single carbon transfer reaction. For example, transfer of a methyl, methylene or formyl group. Tetrahydrofolate is an essential cofactor in the transformation of DUMP to DTMP, which is an essential step in the synthesis of purines and thereby DNA. Folic acid is also involved in the transformation of certain amino acids as well as in the synthesis of purines and DTMP needed for the synthesis of nucleic acid, that is DNA, required by all rapidly growing cells. In humans, folate deficiency results in serious pathologies such as neural tube defects, megaloblastic anemia, acceleration of the arteriosclerotic process, changes in the central nervous system, and the development of certain types of cancer. So this folic acid is given to women intending to become pregnant and in the early months of pregnancy in order to reduce the risk of neural tube defects and other birth defects. Question number 29. Which of the following is a MAVO-B inhibitor? That is monoamino oxidase B inhibitor. The options are seligilin, moclobemide, desipramine, and venlafaxine. So the correct answer is option A, that is seligilin. Seligilin is a MAVO-B inhibitor. Moclobemide is a MAVO-A inhibitor. Desipramine is a tricyclic antidepressant, and this venlafaxine is an SNRI, that is serotonin norepinephrine reuptake inhibitor. Monoamine oxidase or MAO is a mitochondrial enzyme found in nerves and other tissues such as the gut and liver. In the neuron, MAO functions as a safety valve to oxidatively deaminate and inactivate any excess neurotransmitters, for example, norepinephrine, dopamine, and serotonin, that may leak out of synaptic vesicles when the neuron is at rest. These monoamine oxidase enzymes exist in two forms, that is MAO-A and MAO-B. MAO-A inhibition is thought to be more important for antidepressant properties. The four MAO inhibitors currently available for the treatment of depression include phenylephrine, phenylcypromine, isocarboxide, and seligilin. So these MAO inhibitors can be classified on the basis of whether they are non-selective or selective for either MAO-A or MAO-B, and whether their effect is reversible or irreversible. So these non-selective MAO inhibitors include phenylephrine, isocarboxide, and phenylcypromine. And selective MAO inhibitors include seligilin and rasagiline. They are irreversible and selective inhibitors of MAO-B, and safinamide is reversible and selective MAO-B inhibitor. Chlorgelin is selective for MAO-A. And this moclobemide is an example of reversible MAO inhibitor, especially MAO-A. Then phenylcypromine, phenylacin, isocarboxide, and seligilin irreversibly inhibit monoamine oxidase. Seligilin is also used for the treatment of Parkinson's disease. It is the only antidepressant available in a transdermal delivery system. The seligilin administered as a transdermal patch may produce less inhibition of gut and hepatic MAO at low doses because it avoids first-pass metabolism. Now comes an important point, that is the dietary restrictions. Consuming high levels of dietary tyramine while also taking MAO inhibitors can lead to raised blood pressure, including in some cases serious life-threatening hypertensive crisis. Tyramine, which is contained in foods such as aged cheese and meat, pickled or smoked fish and red wines, is normally metabolized by monoamine oxidase in the liver and intestinal cells. With MAO inhibition, tyramine is not metabolized in the gut and passes directly into the circulation, where it may release norepinephrine and thereby causes hypertension. Question number 30. Potassium secretion occurs in which part of the kidney? The options are proximal convoluted tubule, loop of Henle, Bowman's capsule, and collecting duct. So here the correct answer is option D, that is collecting duct. All these options are parts of nephron. Nephron is the functional unit of kidney. So this potassium secretion occurs mainly in the late distal collecting tubule, that is DCT, and the collecting duct. The purpose of secretion is to control the serum potassium levels in the long term. So with this question, we have finished today's 5 recalls question. Thank you all for watching this video. Let's see in the next video.